Hello Mr. Devon, I'm Shakila, entry of this office. After reviewing your medical history, I want to discuss some most important points for your health condition. To begin with, I'd like to define what is blood pressure. Blood pressure is the measurement of force exerted by the flowing blood to the artery walls, which ultimately exerted by the heart carried to different body parts. Now, if there is persistent elevated numbers of blood pressure occurring, it is called high blood pressure or hypertension. Blood pressure expressed as two numbers. For example, if someone says your blood pressure is 136 over 79, here the top number is pressure within the arteries when the heart contracts. The bottom number is pressure within the arteries when the heart relaxes. Normal blood pressure is usually numbered as top, which is systolic blood pressure, and um, the lower number, which is a diastolic blood pressure. The systolic blood pressure is usually should be less than 120 and the diastolic blood pressure should be less than 80 millimeter of mercury. It is called elevated when the top number is within 120 to 129 and the lower number is less than 80. High blood pressure or stage 1 hypertension is when the top number is within 130 to 139 and the lower number is less than 80. The stage 2 hypertension is when the top number is 140 or more than 140 and the lower number is 90 or higher. The value of blood pressure is mainly determined by the resistance that blood encounters to the smallest arteries and also depends on force of contraction of the heart. To be little more clear, the higher effort the heart needs to pump blood, the blood vessels needs to contract more. Regulation of blood pressure depends on regulatory system actions. For example, peripheral resistance is the resistance of blood flow per blood vessels. It is mainly determined by the size of the blood vessels. The relationship between vessels and resistance are not linear. Quite small decreases in vessel size may cause large amount of resistance. As a result, we can say size is one of the main regulatory factors in peripheral resistance. In most cases, hypertension is caused by increased peripheral resistance. Nervous regulation tries to maintain adequate level of blood pressure by instantly correcting and adjusting blood pressure. Sympathetic nervous system tries to regulate the diameter of muscular arteries, explaining why they are responsible for changing peripheral resistance. This response tends to minimize the change in blood pressure. The kidney have its own regulatory mechanism. This is the renal fluid balance control to regulate the blood pressure exerted to the arteries as the heart passes blood throughout the body. When the system is activated, substances are released that contract the vessel walls and release hormones that reabsorbs water and sodium. This will produce an increase in blood volume and contraction of vessels, aggravating hypertension. Changes in any of these mechanisms can cause hypertension and vice versa. On the other hand, there are two forms of hypertension: primary hypertension or essential hypertension, which also called silent killer, as many people have no symptoms. It is associated with various genetic factors such as body weight, sodium in diet, chronic and excessive uh, consumption of alcohol. Secondary hypertension is the high blood pressure which suddenly manifested on regular blood pressure, which becomes labile. This type of blood pressure has some identifiable causes, usually related to kidneys or hormonal glands. As doctors or nurses, we use terms high blood pressure or hypertension as an warning because it can put you on the risk of having a heart attack, stroke, or kidney diseases. In general, high blood pressure symptoms doesn't appear for a long time. Some symptoms may include headache, shortness of breath, dizziness, chest pain, heart palpitations, or nosebleeds. Lack of taking care of hypertension can eventually lead to heart failure. If the blood pressure is high, the heart needs to excrete more force to overcome the resistance. This leads to thickening of ventricles over time, make difficult to fill the heart completely before it contracts again, and empty the heart chambers to arteries. As ventricles are not filling properly but accumulates in pulmonary arteries and in the lungs, producing an unpleasant sensation or difficulty of breathing called dyspnea, especially when you are exerting yourself. This is one of the most prominent symptoms of heart failure that unfortunately you are presenting today. Other possible symptoms are very rapid weight gain related to fluid retention, fatigue or weakness, swelling on dependent body parts like legs, rapid or irregular heartbeat, decreased ability to do exercise, swelling of abdomen, and numerous other symptoms. Something that worries me is your weight gain. Weight gain or excess body fat has direct negative effect on blood pressure. For that reason, you have to take a strong initiative to lose weight. Here are some instructions on your care. Number 1, reduce the amount of salt you eat. Higher salt intake is closely related to increased sensation of hunger and fluid retention, which eventually will increase blood pressure and weight gain. Number 2, get regular physical activity or exercise. Physical activity will increase strength to your heart. Stronger heart can pump more blood with less effort. If your heart can work less to pump blood, the force on the arteries decreases, which lowers blood pressure and helps to lose weight. Number 3, choose a diet low in fat, enriched in fruits, vegetables, and dairy products. Also, try to replace sodas with milk or yogurt. Follow DASH diet, which emphasizes correct portion sizes and encourages you to decrease sodium and to incorporate with variety of fruits and enriched nutrients to help lower blood pressure and maintain an ideal weight. Number 4, cut down alcohol intake. Alcohol contains many calories to contribute to weight gain, which is a risk factor for blood pressure. Also, alcohol can interfere with the effectiveness and increase the side effects of blood pressure medications. Number 5, manage your stress level. Increased levels of stress can cause a temporary but dramatic increase in blood pressure. And finally, don't stop taking your blood pressure medicines. They can maintain better blood pressure, eventually prevent heart attack, heart failure, stroke, and save your life. Let me know if price is an issue for you, as I can prescribe a less expensive one. It is also a good idea to purchase a blood pressure machine to monitor and record blood pressure at home regularly and to bring it to me in next appointment. Doing so, you can control your blood pressure and monitor your blood pressure. Thank you for listening to me, and please ask if you have any question.